artery. It extends from lower border of teres major to the neck of radius. So this is our teres major muscle. To the neck of radius. This brachial artery has few branches. One of the main branches are profunda brachial artery. This profunda brachial artery runs in the spiral groove along with the radial nerve. So to remember few other branches of brachial artery, you can remember this mnemonic: Miss profunda runs in spiral groove. M stands for muscular artery, profunda brachial runs. Muscular, profunda brachial, radial ulnar terminal branches, nutrient artery, inferior and superior ulnar collateral arteries. Now let's move on to anastomosis around elbow joint. This is profunda brachial artery, which gives two branches, anterior and posterior descending branches. The shaded part is brachial artery. It's giving two more branches, inferior ulnar collateral, and the dotted ones are superior ulnar collateral. The two terminal branches, radial and ulnar artery. Radial artery gives a branch called recurrent radial branch. This is common interosseous branch of ulnar artery, which gives anterior interosseous and posterior interosseous branch. This posterior gives a recurrent branch. Ulnar artery, it gives anterior recurrent and posterior recurrent branches. So we have anastomosis between the branches of brachial, ulnar and radial artery. See, profunda brachial gives anterior descending, posterior descending branches. That is in front of lateral epicondyle. We have anterior descending branch of profunda brachial from above and recurrent branch from the radial artery from below. So these branches anastomose in front of the lateral epicondyle. Behind the lateral epicondyle from above, you have posterior descending branch of profunda brachial, and from below recurrent interosseous branch from posterior interosseous branch of common interosseous artery from the ulnar artery. On the medial side, in front of medial epicondyle, we have inferior ulnar collateral, from the brachial artery, anastomosis with the anterior recurrent branch from the ulnar artery. Behind the medial epicondyle, we have superior ulnar collateral from brachial artery, which anastomoses with posterior recurrent from ulnar artery. Now the radial artery, one of the terminal branches of brachial artery at the neck of radius. You can see it gives a recurrent branch above to anastomosis with the descending branch of profunda brachii. And this radial artery descends down with the lateral convexity. Below it turns backwards and runs in the anatomical snuff box. Before it comes to the dorsum, it gives a branch called superficial branch. And you can see the artery from the anatomical snuff box. It passes to the palm by piercing between the two heads of first dorsal interosseous muscle and between the two heads of adductor pollicis. Then this radial artery forms deep palmar arch, which is completed by the deep branch of the ulnar artery. So the deep palmar arch is mainly formed by radial artery. Now ulnar artery, it gives the common interosseous branch. The common interosseous gives anterior interosseous and posterior interosseous. This anterior interosseous, just above the pronator quadratus, it gives a branch to palmar carpal arches. Then it pierces the interosseous membrane to anastomose with the posterior interosseous artery, which also gives branches to the dorsal carpal arches. Now the ulnar artery descends medially to give superficial and deep branch. The superficial branch of ulnar artery mainly forms the superficial palmar arch. It gives a deep branch to complete the deep palmar arch of radial artery. Superficial and deep palmar arches. The radial artery, it forms the deep palmar arch, and ulnar artery mainly contributes for the formation of superficial palmar arch. What does these arches supply? On the lateral side, the radial artery gives a branch to the thumb called princeps pollicis, to the index finger radialis indicis, only to the lateral side of the index finger. Now we have three common digital arteries from the superficial palmar arch and one proper digital artery. These three common digital arteries supplies adjacent side of index middle ring and little finger. This proper branch supplies the medial side of little finger. The deep palmar arch gives branches called metacarpal arteries. It gives recurrent branch to the palmar carpal arches. It also gives few perforating branches to anastomose with the metacarpal arteries on the dorsal side. Moving on to venous drainage of upper limb. This is dorsal surface of the upper limb. So we have a venous arch on the dorsal surface of the hand. What are the veins drains into this dorsal venous arch? So the venous arch is mainly formed by two dorsal digital veins of thumb, one dorsal digital vein of little finger, and three metacarpal dorsal veins of second, third, and fourth digits. Once the dorsal venous arch is formed, its medial end ascends upwards, runs through the snuff box, which is the cephalic vein. On the medial side, we have basilic vein which ascends up. Later, these two veins turns forwards to run on the ventral surface of the forearm. On the lateral side, you have cephalic vein which ascends above to run in a groove called deltopectoral groove. This is the deltoid muscle, and below we have pectoralis major. This vein runs in the groove between pectoralis major and deltoid, called deltopectoral groove. On the medial side, this basilic vein ascends up at the lower border of teres major. This basilic vein becomes axillary vein till the outer border of first rib. So axillary vein extends from the lower border of teres major to outer border of first rib. Later it becomes subclavian vein, joins with the internal jugular vein to form brachiocephalic, which joins with the left brachiocephalic and drains into SPC. So SPC and IVC drains into right atrium of the heart. Now what is the extent of axillary artery? It is from outer border of first rib to lower border of teres major. Remember, from the second part of axillary artery you have a branch called lateral thoracic artery. Similarly, from the axillary vein you have a vein called lateral thoracic vein. What is the importance of the lateral thoracic vein? When you have a block in the inferior vena cava, venous drainage from the lower limb is obstructed. So what happens, from the superficial epigastric vein, which is a tributary of femoral vein, has a connection to the lateral thoracic vein of our axillary vein through a tributary called thoracoepigastric vein. So this thoracoepigastric vein is the link vein between upper limb and lower limb. Through the thoracoepigastric it reaches lateral thoracic and axillary, then to the subclavian, superior vena cava, blood finally reaches the right atrium. So this is the lateral circulation when the IVC is blocked. Notice the vein connecting cephalic and basilic vein. Yes, that is median cubital vein. And you have one more vein which drains the palm called antebrachial vein or median vein. This median vein joins the median cubital vein. So this is the superficial venous system of upper limb. Now what are the deep veins present in the upper limb? From the palmar venous arches, the vein drains into the venic commitments of radial and ulnar artery. You have veins on either side of radial artery, ulnar artery, and this venic commitments joins the venic commitments of brachial artery called brachial veins. These brachial veins joins the basilic vein on the medial side. If the axillary vein has to be removed in the cases like CA breast, you have a communicating vein from the cephalic vein to the external jugular vein, which helps in the drainage of upper limb. Thank you.